Hey there, this is Dr. Tall Paul Simon, psychiatrist. All right, we're going to talk a little bit about anxiety disorders, um, different diagnoses that people can get labeled with based on their symptoms and what they're struggling with and how their anxiety manifests to them. So, anxiety can show up in a lot of different ways. Okay, in the last video, we talked a little bit about the physical symptoms of them, but also the mental symptoms of various types of anxiety and experiences. So, general anxiety covers a lot of different worries. Okay, so general anxiety disorder, for example, probably the most common anxiety disorder out there. It's where somebody worries about a general array of lots of different things too much. Okay, so remember, some anxiety is normal, too much is too much, and it's interfering in our life. So generalized anxiety, basically people are worried about everything, their health, their relationships, money, what they have to get done. I mean, all these things that are normal, but they can't settle down and let things go. All right. So it can affect in their life in a lot of different ways. Their sleep, give them muscle tension, physical symptoms, make them irritable, a lot of different things there. So that's generalized anxiety disorder. Now, some people will have more narrow um, focuses of their anxiety, so they'll have phobias, for instance, and that's like more of a physical reaction to being around certain things. And they think there's a evolutionary things such as, avoiding heights or spiders or snakes or different phobias people will have that, again, protects them from those things, but can be pretty annoying if they can't even look at a picture of a snake, or a rubber snake just terrifies them and it's embarrassing. So that's more of a phobia kind of thing. Now, people can have OCD, which is obsessive compulsive disorder. That's um, one where people have um, obsessions, where people obsess over things. And thinking of that term, it's a thought or a worry that just gets in their head and just is stuck in there. It's almost like an earworm or something, like a song gets stuck in your head, but it's a concern, it's a worry, um, or it's a fear that they might do something bad, and those obsessions can almost, really be, terrifying in a way, in that some people obsess over, germs or, ordering things or checking things, but some people also have obsessions where they worry that they might do something bad to somebody else, and that's their worst fear. And so it gets stuck in their head. They can't get it out. And the compulsions part of OCD is where they have to do something. They're compelled to do something to relieve that anxiety that comes with the obsessions. So the compulsions are like to check things, or to monitor things, or to order things, to keep things clean, or avoid some physical sensation of discomfort or uncleanliness, like a contamination feel. Um, or some people are compelled to like say things or count things or do things in their mind. It can be just mental, it can't be obvious to anybody else sometimes. So the compulsions can take a lot of different forms, and it can take up a lot hours, of a person's day. That can be quite a burden, as you can imagine. Some people have it to a less degree, and that's more of an obsessive compulsive personality disorder, perhaps. So other types of anxiety disorders are like a social phobia, for example, or social anxiety disorder, where maybe as a kid it starts off as just being shy around people, but as an adult, it can lead to just a real strong emotional and physical reaction to having to be around people in a public setting or around strangers and different things. And that can really interfere, as you can imagine, with school performance or work performance. If you have to give a presentation or something and you can't do it because your body is just terrified of that, it's not even a volitional thing. They don't want to feel that way. It's just the body's protecting them from social risk. Okay, but that is not being regulated in their brain for whatever reason, and it's not that is associated with trauma or something that happened. Some people just their brain doesn't regulate that signal very well. So with medications that we'll get into later, all these different types of anxiety disorders can be treated with medications and therapy and counseling. So it's not just medications, you know, it just depends on how bad it is. So we'll get into that later. But other types of anxiety disorders like post-traumatic stress disorder, that's associated with exposure to trauma. So it's got to be some kind of dangerous trauma or perceived dangerous trauma to themselves or somebody else that they love. So typically, the most strict definition of PTSD requires an exposure of like life-threatening stuff. So car crashes, explosions, fires, domestic violence, gunshots, all the wartime stuff. Not completely necessary nowadays for the diagnoses. It's kind of been broadened to more cumulative trauma. So, like, if you have multiple things that happen over years that are really scary to the person, and it can be almost emotional trauma too. So somebody abandoning the person repeatedly and then coming back and then, threatening and all this kind of stuff. That can be a cumulative kind of effect over the years. So, anxiety and trauma go hand in hand, but everybody's different as far as how they respond to things. Now, anxiety, where does it come from? Now, I'll get into a separate video. Okay. Same thing with the treatment and types of options out there for anxiety. Okay. So I hope you found this video helpful. It's a brief introduction. Please subscribe to my channel. That helps me do more of these and reach more people. So hope you guys are doing okay. And I use guys, just broadly for everybody, and non gender specific. Okay. So I hope you all are doing okay, and take care.